in your ears, huh? Do you have bunnies in there?
I think when a parent's trying to make a decision between urgent care versus emergency room, the deciding factors would be how responsive is the child. If the child is still, answering questions, making eye contact, looking at the parents, I think that can generally be seen in an urgent care center. A child that's having seizures, a child that's in severe respiratory distress, not responding well, if they're vomiting so much that they're now very lethargic, where they may need IV fluids, those are type of circumstances that the emergency room would be more appropriate. When it comes to fever, parents are often confused about what to do. Generally recommend that if a fever is not over 101.5, it probably doesn't even need treatment. The fever is actually a benefit to our bodies. It fights off infections. Viruses, bacteria don't like temperature over 98.6, so low-grade fever is a good thing to let it run. I always tell parents, look at the child before you look at the thermometer. A child that has a fever of 101 but's not very responsive is much more of a concern than a patient who has 103.5 but they're still talking to you and responding. If a parent has a concern about their child, the best first thing to do is contact their doctor. And if you can't get a hold of them, then certainly come into the urgent care center and get evaluated. And in the high risk, if you're very concerned, certainly go to the emergency room.